Hello, my name is Dr. Neil Kjos, owner of Kjos Functional Medicine here at Chattanooga Holistic Medicine. And I'm here today to talk to you about the neurotransmitter test from ZRT. This is one of my favorite tests. It helps to determine levels of neurotransmitters in your brain that really dictate your personality. It helps indicate why a person would have ADHD, OCD, depression, anxiety, and everything in between. It's a test that I run on everyone, or can be run on everyone. I do it on myself twice a year, and I use various supplements based on the neurotransmitter levels in my brain just to tweak it a bit, and I tend to find that I'm about 5% happier as a result of that. For some people, it makes a bigger difference. A good example would be if your dopamine is too low, very low, and then we need to increase the dopamine, or the serotonin is too low, or the individual's GABA, which is a inhibitory neurotransmitter that's very calming. But then you can have excitatory neurotransmitters like glutamate that could be elevated. And then we need to look at why is it elevated and how do we bring it down. So it is a balance between inhibitory and excitatory neurotransmitters that at the end of the day is going to determine your behavior in your brain. The test is simple to do. It is a urine test. And so when we open up the box, we have the test requisition, which I will sign it and check off the correct lab test that we're going to do. And then that will have to be completed and then put back into the box. There are some instructions as far as foods that you need to avoid beforehand. And the main foods to avoid are nuts, nut butters, protein powder, bananas, pineapple, the day before and the day of the test. Oh, and I forgot, alcohol and nicotine need to be avoided also. If you're using hair and nail formulas that are very high in B vitamins, B7, then we need to go ahead and refrain from that for about 3 days before testing. Okay. Other than that, it is 4 urines using these nifty little urine strips. You pee into a cup and then you take out a strip. Make sure you sign it, date it, put the time of the collection, open it up. This is the sensitive paper here. You're going to put this into the urine, pull it back out, and then hang it to dry. Just hang it to dry for how many hours it takes for it to dry out. You could put it on a wire hanger, a clothes hanger, whatever you need to do. Sometimes I'll just suggest leave it overnight because we have 4 of them and just put them all on the same hanger. In the morning, you can go ahead and just put them all back together, put them back into the bag, make sure there's not a single wet one in there, close the bag off. The bag goes back into the box along with the requisition. The whole box goes into a bag, and then on the bag is a self-addressed UPS second day air label that goes over the bag, and then it's shipped out. There is a second tube, or I should say a tube added to this saliva tube in the event that we're going to do an add-on test. So there are additional tests that you can add on to the neurotransmitter. If you combine tests together, ZRT will offer a discount to the testing. And that is the neurotransmitter test. And the results for this will be back. Typically, I usually schedule the patient out a month. They'll be back in 3 weeks to a month. So that's how long it takes. Okay? Thank you.